All right, so we are back and we are finishing up the skeletal system with the appendicular skeleton. So, before we go into this lecture on the appendicular skeleton, let's keep in mind our general bone marking terms and understand the definitions of those because that'll help us actually identify the specific bone markings on these appendicular bones. We're also going to be introducing a bunch of joints. Now, the only joints that we've mentioned so far are the four suture joints between the cranial bones and the atlantoaxial joint between atlas and axis, C1 and C2 in your vertebral column, and the atlanto-occipital joint, which is between atlas and the occipital bone, those occipital condyles of the occipital bone. So, as we're mentioning these joints, please keep in mind what bones are forming the joints as well as which bone markings are involved, if there are any. So, just a reminder, the skeletal system is broken into the axial skeleton and the appendicular skeleton. The axial is composed of the skull, the thoracic cage, and the vertebral column. The appendicular skeleton is composed of your upper and lower limbs. If you're having trouble remembering what bones make up the appendicular skeleton, I like to think of it like appendages, appendicular appendages. Okay, there's something there. But those limbs are going to be attached to the axial skeleton via something called girdles. We have two sets of girdles in the body. There are the pectoral girdles and the pelvic girdles. There are two pectoral girdles that will assist in connecting the upper limb to the axial skeleton, and the pelvic girdle one of those will assist both lower limbs assist in attaching those lower limbs to the axial skeleton. In total, the appendicular skeleton is made out of 126 bones. So we're going to start with the pectoral girdle. Now, the pectoral girdle is made out of two bones, the clavicle and the scapula. If you're looking anteriorly at a body, the clavicle will be in view, extending medial to lateral. On the posterior view, you have view of the scapula. All right. When we're talking about the pectoral girdle, it's really important to keep in mind that this is considered an incomplete girdle. And what I mean by that is that this girdle does not encircle the entire body. It does not form a complete circle. Okay, so you can even see that. You have the start of a circle here, and it comes, and it'd be coming anteriorly, and it would be wrapping around, and then it just stops. Okay, so it is an incomplete girdle because of that fact. Now, because it's incomplete, it is technically less stable, but it does allow for more flexibility, right? Because it's not completely encircling the body. So there is more flexibility, but it is less stable. Now, between these two bones, the clavicle and the scapula, clavicle being anterior and the scapula being posterior on the body, only the clavicle is actually going to be articulating with the axial skeleton. So the scapula, there is a lot of muscle on this anterior side of the scapula, and it doesn't actually connect to the skeleton. It doesn't form a joint with the axial skeleton. The clavicle, however, does form a joint with the axial skeleton. We have already kind of talked about this. The clavicle will articulate with this superior portion of the sternum. If we could take a moment, quiz yourself, what is that superior portion of the sternum? It's the manubrium. Okay, so the clavicle will articulate with the manubrium at the clavicular notches of the manubrium, and it'll form the sternoclavicular joint. All right, so sternoclavicular joint. So that is how the clavicle articulates with the axial skeleton. And then it would be repeated on the other side, okay, the left side. All right. There are two other joints that get formed via the pectoral girdle. As the scapula posterior kind of wraps around anteriorly, it will articulate with the clavicle lateral to the trunk, right? So in the lateral position, these two bones articulate and they form the acromioclavicular joint. Also on the scapula, there is kind of a opening and surface, a bone marking that allows the articulation of the humerus, which is the bone of the arm, the brachial region. All right. As the humerus articulates with the pectoral girdle, it does create the glenohumeral joint. So there are technically 3 joints associated with the pectoral girdle. But it's important to keep in mind that the scapula, this posterior bone of the pectoral girdle, is not actually articulating with the axial skeleton itself. It does so indirectly. All right, so just a closer view of those joints, right? So we have that sternoclavicular joint where we actually have the connection of this girdle to the axial skeleton, the acromioclavicular joint between the scapula and the clavicle. They articulate at the lateral position of the body, and the glenohumeral joint where we actually see that connection between the girdle and the upper limb.